Hello everyone. Today we will present physiology of aging skeletal system. Our group members are Satanin Gevorgian, Vasilisa Mistich, Shoshana Stepanian, Tanya De Anda, Zarina Joraeva.
Anatomical structure. Introduction of bone. What are bones? Bones are the rigid bars that are made up of connective tissues. These are living tissues that are capable of growth and perform vast numbers of function. These are the reservoirs of about 99% of calcium of our body. The basic unit of human skeleton is bone. Human body contains 206 bones. Bone is essentially a high vascular, living, constantly changing mineralized connective tissues. It is remarkable for its hardness, resilience, and regenerative tissues. Bone matrix composed of organic materials, mainly collagen fibers, and inorganic salts rich in calcium and phosphate. So bone growth. Bone growth in length at the epiphyseal plate by a process that is similar to the endochondral ossification. The cartilage in the region of the epiphyseal plate next to the epiphysis, it continues to grow by mitosis. The growth of cartilage continues in two ways. The first one is a appositional growth. In appositional growth, cartilage forming cells in the surrounding perichondrial secretes new matrix against the external face of the existing cartilage tissue. The second one is the interstitial growth, and the interstitial growth has the lacunae bounding to the chondrocytes divided and secretes new matrix, expanding the cartilage from within. Typically, cartilage growth ends during adolescence when the skeletal stops growing. Bone marrow. Bone marrow is a spongy tissue inside some of your bones, such as your hip and thigh bones. Stem cells can develop into the red blood cells that carry oxygen through your body, the white blood cells that fight infections, and the platelets that help with blood clotting. Many people with blood cancers such as leukemia and lymphoma, sickle cell anemia, and other life-threatening diseases rely on this bone marrow and cord blood transplant to survive. What is calcium? Calcium is the most abundant mineral in the body. This mineral is naturally found in food, added to some, available as a dietary supplement, and present in some medication. Most of the body's calcium is found in bone and teeth, estimated to be 99% of calcium in the body. Approximately 1.5 through 2% of the body weight. An adequate intake helps grow a healthy skeleton in early life and minimize bone loss later in life.
Bones classification by location and shape. Bones are divided into two groups, axial and appendicular. The axial skeleton is the part of the skeleton that consists of the bones of the head and trunk of the vertebrate. The appendicular skeleton consists of the bones of the upper and lower limbs and the girdles that match the limbs of the axial skeleton. Bones comes in many sizes and shapes. The unique shapes of each bone fulfills at particular needs. Long bones, as their name suggested, are considerably longer than they are wide. Short bones are shaped roundly as acute and contain mostly spongy bones. Flat bones are bones whose principal function is either extensive protection or the provision of the broad surfaces of muscular attachment. Irregular bones have complicated shape that fits none of the preceding classes. There are important bone functions such as support. Bones provide a framework that supports the body and cradles its soft organs. Protection. Fused bones of skull, vertebrate, rib cage. Movement. Skeleton muscles use bones as levers. Mineral storage. Bones is reservoir for minerals, mostly important calcium and phosphate. Most blood cells formation occurs in the red marrow of certain bones. How bones are remodeling. Every year, remodeling places about 5 to 10% of our skeleton, and our entire skeleton is replaced about every 10 years. This is essential because when bone remain in place for a long period, more of the calcium salt crystallize and the bone becomes more brittle, ripe condition for fracture. Together, bone resorption and deposition constitute bone remodeling. Bone resorption is the process by which osteoclasts break down the bone tissue. This process is crucial in the maintaining of the blood calcium level. Abnormal increase in the activity of osteoclasts that produce an increase in bone resorption cause osteoporosis and other bone loss associated diseases. Bone desorption, osteoclast secrete osteoid. Classification of bone occurs when calcium and phosphate ions move out of the blood into the bone tissue. Homeostatic imbalance. Minute changes from the homeostatic range of blood for blood calcium can lead to severe neuromuscular problems. The hormonal controls primarily involve parathyroid hormone produced by parathyroid gland. When blood levels of calcium decline, PTH is released. The increased PTH level stimulates osteoclasts to resorb bone, releasing calcium into the blood. The PTH still stimulates the osteoclast is indirect. Various cell responds to PTH secretion by providing another protein that stimulates the formation and activity of osteoblasts.
Bone fractures and repair. Fractures are classified into three parts. Position of the bone ends after fracture. They can be non-displaced, which means that they retain their normal position, or displaced fractures, which means it snaps into two parts. Also, fractures classified by completeness of the break, complete or incomplete fracture. The last is whether the bone ends penetrate the skin, open or closed fractures. As you can see on the picture, we also have different types of fractures. Spiral fracture is common sport fracture. Comminuted fracture, particularly common as we age because bones become more brittle. And you can see that oblique and comminuted fractures are usually open and penetrate the skin. However, we need our bones to be treated because the main function of them is to maintain posture. Treatment begins with the reduction of the broken bone ends. After the broken bone is reduced, it is immobilized either by cast or tracting to allow healing. Repair in a simple fracture involves four major stages. The first stage is a hematoma formed by blood clotting. During the second stage, fibrocartilaginous callus form. Within a few days, new blood vessels grow into the clot. Fibroblasts produce collagen and the chondroplasts secrete a cartilaginous matrix. This entire mass of repair tissue splints the broken bone. The third stage describes as bony callus forms. Within this mass of repair tissue, osteoblasts begin forming spongy bone. Within a week, osteoblasts begin to lay down trabecular of new bone around and within the fibrocartilaginous callus. Gradually, the fibrocartilaginous callus is replaced by immature bone, converting it to a bony callus. The last stage is bone remodeling. The excess materials on the diaphysis exterior and within the medullary cavity is removed. Compact bone is laid down to reconstruct the shaft walls. However, people may have fractures that do not have an ability to repair itself. To return people to their lost bones, bioengineers created bone reconstruction. Some current treatments replace missing bone with metal, bone putty derived from the deceased donors, or grafted bone from elsewhere within a person's own body. Also, bioengineers grow living bone for facial reconstruction. For example, pig jaws. They replaced piece of the pig jaw bones with cow bone matrix. The material left after removing its resident cells. This matrix served as a scaffold for the graft. Guided by precise imaging technology, the researchers individually shaped each cow bone scaffold to fit perfectly into the missing jaw bone region. Also, scientists have developed a new bone engineer technique called segmental additive tissue engineering. The technique allows researchers to combine segments of bone engineered from stem cells to create at large scale. Personalized graft that will enhance treatment for those suffering from bone diseases or injury through regenerative medicine. In addition to bone engineering, scientists came up with different ideas in diagnostic. For example, the innovation include 3D imaging, CT scan that improve implants position. Also, they colored MRI scan used to see healing process. And lastly, X-ray that is used to diagnose fracture bones and joint dislocation.
Bone diseases. Strong bones are important for our health. Bones are living tissue just like all other parts of our body and are constantly going through a cycle of renewal. Older bone tissue is replaced with new formed bone tissue in a process called remodeling. We commonly measure the condition of our bones by its density or bone mass. A bone mineral density screening can help a physician identify the calcium content of a bone and thus how strong our bones are. Our bone density peaks when we are young adults, typically between the age of 25 and 30. Therefore, as we continue to grow, our bones gradually lose density. Three most common diseases that affect the bone are osteoporosis, Paget's disease, rheumatoid arthritis. Osteoporosis, which means porous bone, is a disease in which the density and quality of bone are reduced. Bone density problems may occur because the body loses too much bone tissue, makes too little of it, or some combination of both. Paget's disease. This is a bone disorder where the bone renewal process remodeling occurs too quickly, leading to bone deformities. In Paget disease, this process is abnormal because the bones regrow too quickly. They are bigger and softer than normal. Rheumatoid arthritis is a chronic disorder in which the immune system mistakenly attacks the body tissues, such as the joints in the hands and the feet. Rheumatoid arthritis affects the lining of your joints, causing a painful swelling that can eventually result in bone erosion and joint deformity. Our bones help us move, give our shape, and support our body. They are living tissues that rebuild constantly throughout our life. During childhood and our teens, our body adds new bone faster than removes old bone. To have strong bones when we are young and to prevent bone loss we are older, we need to get enough calcium, vitamin D, and exercise. We should also avoid smoking and drinking too much alcohol. Everyone should be informed of basic elements of maintaining bone health and preventing bone disease. There are some treatments that can help to protect bone, such as to maintain bone health, physical activity, drug therapy. Like muscle, bone is living tissue that responds to exercise by becoming stronger. Exercising can also help us maintain muscle strength, coordination, and balance. There are two primary types of drug therapy for osteoporosis. The first reduces bone loss, and the second are drugs that build bone.
Osteoporosis. Now I would like to talk more deeply about osteoporosis. Osteoporosis is a disease characterized by a decrease in bone mass that occurs when the rate of bone resorption exceeds the rate of bone formation, which is common as the body ages. Although osteoporosis can affect any bone, it most often affects the proximal ends and the vertebrae and wrist. As a result of loss of bone density, bone tissue may not provide adequate support for everyday function, and something as simple as sneezing can cause a spinal fracture. In the United States, more than 53 million people either already have osteoporosis or a high risk due to low bone mass. This picture shows that women lose bone mass more quickly than men, starting at about 50 years of age. This occurs because 50 is the approximate age at which women go through menopause. Not only do their menstrual periods lessen and eventually cease, but their ovaries reduce in size and then cease the production of estrogen, a hormone that promotes osteoblastic activity and production of bone matrix. Thus, osteoporosis is more common in women than in men, but men can develop it too. There are various methods for diagnosis osteoporosis. Dual energy X-ray, absorptiometry, recognize bone mineral density, ultrasound, computerized tomography, and bone radiography. Osteoporosis can be prevented or at least delayed by minimizing the factors that you can control. A comprehensive osteoporosis treatment program includes a focus on exercise, proper nutrient, It must be obtained from our diet, in particular calcium and vitamin D, vitamin K, and many others. Sunlight is one source of vitamin D, and also safety issues to prevent falls that may result in fractures. And of course, you should avoid smoking, drinking alcohol, and minimize coffee in your diet because it all reduces calcium level. In addition, your doctor may prescribe a medication to slow or stop bone loss, increase bone density, and reduce fracture risk. Currently, treatments for managing osteoporosis include bisphosphonates, calcitonin, and estrogen for women only. Today, the US Food and Drug Administration approved Evenity to treat osteoporosis in postmenopause women at high risk of breaking a bone. This medication is a monoclonal antibody that blocks the effects of the protein sclerostin and works mainly by increasing your bone formation. Thank you for your attention and stay safe.